Our topic is on unusual presentation and complication of caustic ingestion. We chose this topic because it is very relevant to the topic acids and bases, which we are learning about right now. We even use some of the caustic substances in lab. Also, it is very interesting how many household products contain caustic substances despite the risk of ingestion, which could be deadly. What is caustic soda? It is a very strong and very corrosive base. The most common is NaOH, or sodium hydroxide. Caustic sodas are used very often to make soap. Many times they are accidentally ingested due to looking much like water or alcohol.
What are the effects of ingestion? Ingestion of caustic substances causes injuries to the upper respiratory tract and the upper gastrointestinal system. Tissue destruction is also very common. The severity of these effects are dependent on the concentration of the substance, how much was ingested, and at what time it was ingested. What are the long-term effects of ingestion? Some may include corrosive esophagitis, a buildup of tissue within the esophagus, narrowing of passageways, or even cancer of the esophagus.
In our article, a case was presented involving a 65-year-old woman who had accidentally ingested 100 milliliters of sodium hydroxide, a caustic soda. In the ER, she arrived displaying symptoms including oral pain, pain while swallowing, and nausea. Her x-rays were negative for any damage, but 1 hour after admission, she began wheezing, rapidly breathing, and was unable to speak. A barium esophagram showed caustic stenosis. In the following days, the patient eliminated mucosa with compute necrosis and necrotic tissue, an indicator of grade 3 caustic lesions and the need for surgery to repair the damage.
Table 1 represents the endoscopic grading system for caustic lesions. It shows the severity of tissue disintegration which progresses over time. Grade 1 and Grade 2A are the least debilitating because there is no recurrence. Grade 4 is the worst because it indicates complete perforation of the esophagus, and the few who do survive it have permanent strictures. The solid form of caustic soda is less aggressive to the esophagus because it sticks to oral mucosa instead, causing deep lesions. The liquid form only causes stenosis in concentrations less than 10%. More concentrated forms lead to lesions of the stomach and more severe lesions and stenosis of the esophagus. Interestingly, women develop stenosis more than men because they are more sensitive to caustic substances.